Welcome back, my students. Dr. Ogwe here, and today I bring you learning objective number 3rd from cardiac action potentials, which is chapter 31 from guide. And today we are going to study the actions of sympathetic and parasympathetic nervous systems on cardiac action potentials. Is that clear? So our learning objective is, what is the effect of sympathetic nervous system and parasympathetic nervous system on cardiac action potentials? But first we should know what is sympathetic nervous system and what is parasympathetic nervous system. In our body, we have a nervous system called autonomic nervous system. This autonomic nervous system, it originates from brain and spinal cord. So if this is the brain and this is the spinal cord, from these two portions autonomic nervous system originates. And this autonomic nervous system it controls involuntary functions. Is that clear? Now this autonomic nervous system is of two types. Number first is the sympathetic nervous system, and number second is the parasympathetic nervous system. Now this sympathetic nervous system is that portion of autonomic nervous system which originate from the thoracic and the lumbar portion of the spinal cord. So those nerves which are originating from the thoracic and the lumbar portion of the spinal cord, these nerves constitute sympathetic nervous system. So sympathetic nervous system constitutes thoraco-lumbar outflow. Clear? Similarly, those nerves which are originating from this brain, that's cranial portion, and from the sacral portion of the spinal cord. So the nerves that are originating from the brain and the sacral portion of the spinal cord, they constitute parasympathetic nervous system. So parasympathetic nervous system are those nerves which originate from the cranial, that's the brain, and from the sacral portion of the spinal cord. So they constitute craniosacral outflow. Now we will see how the sympathetic nervous system and parasympathetic nervous system affect the cardiac action potentials. Clear? So now we will see how the sympathetic nervous system and parasympathetic nervous system affect cardiac action potentials. First, we will focus on SA nodal action potentials, because these SA nodal action potentials, they generate heart rate. So if these two affect the SA nodal action potentials, they will indirectly affect the heart rate generation. So let's begin with our topic. Now, what is our topic? Effect of sympathetic nervous system and parasympathetic nervous system on SA nodal action potentials. But first we should know what are these SA nodal action potentials. I have made a separate video on these SA nodal action potentials, that is lecture 11 from the cardiovascular system. Go check it out if you want to watch it full. And here for the next 2-3 minutes I am going to recap that what are SA nodal action potentials. That's a recap of lecture 11th from CVS. Let's suppose this is an SA nodal fiber. And when we put an electrode inside of the fiber and outside of the fiber and measure the voltage changes across the membrane of this SA nodal fiber, these voltage changes are called action potentials. And when we put an electrode inside of the membrane, clear, we found that inside of the membrane is negatively charged because of the presence of negative ions. When we put an electrode inside of the membrane, we find that inside there is presence of lot of negative ions, so it is negatively charged. When we measured that negative, we measured that voltage. That voltage came on this electrode equal to minus 60 millivolt. Is that clear? Now, on this SA nodal fiber, there is presence of some channels. These channels are calcium T type of channels, and these channels are sodium F type of channels. These are leaky channels. Both sodium F and calcium T type of channels, they are leaky channels. And what happens through these channels, there is entry of calcium and there is entry of sodium. Rather, there is leakage of sodium and leakage of calcium. On the membrane of this SA nodal fiber, there are presence of some leaky channels. These are those channels which function on their own. We don't have to give any external stimulus for the function of these channels. Clear? So they are leaky channels. And through these channels, there is influx of calcium and influx of sodium. And what does this positive charge do? This positive charge neutralize these negative ions. So this positive charge neutralizes these negative ions, and due to the neutralization, this minus 60 millivolt potential goes towards less negative value. It becomes minus 50, then becomes minus 40 millivolt. Is that clear? Now I will show you this statement diagrammatically. Let's suppose this on x-axis we have time, and on y-axis we have millivolts. This is the action potential of AC node. Initially the potential was minus 60 millivolt inside of the fiber. As the time passes by, this minus 60 millivolt becomes minus 40 millivolt because of the entry of sodium through sodium funny channels, and because of the entry of calcium through calcium T type of channels. Now, when this membrane senses that inside potential is minus 40 millivolt, what this membrane do? It opens some other type of channels. These channels are calcium L type of channels, and what happens through these channels? Lot of calcium comes inside. Is that clear? Now through these calcium L type of channels, lot of calcium comes inside. This calcium neutralizes this minus 40 millivolt to a more less negative value. So these calcium, these are positive charge. They neutralize these negative ions, and they take the potential from minus 40 millivolt to plus 10 millivolt. Is that clear? Now the potential is minus 40 millivolt. What happens at minus 40 millivolt? There is an opening of lot of channels. Those channels are calcium L type of channels. There is calcium influx, and they take the potential from minus 40 millivolt to plus 10 millivolt. Is that clear? Now what happens when this membrane senses that the inside potential is plus 10 millivolt? There is opening of another type of channels. These are potassium channels, and what happens through these potassium channels? Potassium leaks out, and at the same time there is the closure of these L type of channels. So when the inside potential is plus 10 millivolt, calcium L type of channels close and potassium channels open, and there is efflux of potassium. And when positive charge is leaving the cell, it take this potential from plus 10 millivolt back to minus 60 millivolt, because positive charge is leaving the cell, so potential becomes negative. Is that clear? Now I will show you this statement diagrammatically. So what is happening? From plus 10 millivolt, the potential goes back from plus 10 to minus 60 millivolt. It happens because of the exit of potassium. So this is SA nodal action potential. This SA nodal action potential can be divided in three phases. Number first phase is from here to here. This is called pre-potential phase. That's from minus 60 to minus 40 millivolt. Number second phase is from minus 40 to plus 10 millivolt. That's called depolarization phase. And number third phase is from plus 10 to minus 60 millivolt, and this is called the repolarization phase. Is that clear? Now we will move on to the effect of sympathetic nervous system and parasympathetic nervous system on these SA nodal action potentials. So let us suppose this is a graph. On x-axis we have time. Clear? Initially the potential goes from minus 60 millivolt to minus 40 millivolt. Is that clear? So this is the pre-potential phase of the action potential. Then there is depolarization, and then there is repolarization. Is that clear? Now this pre-potential phase occurs because of the entry of sodium through funny channels, and because of the entry of calcium through calcium T type of channels. Now comes the interesting thing. Now comes the effect of sympathetic nervous system. What does the sympathetic nervous system do? It increases the frequency of entry of sodium and calcium. Sodium through funny channels and calcium through T type of channels. So when this sympathetic nervous system is activated, it acts on this pre-potential phase, and it causes more entry of this sodium and calcium. When there is more entry of sodium and calcium, what happens is that this minus 60 becomes minus 40 very quickly in less time. So this minus 60 millivolt becomes minus 40 in very less time. That means the slope of the pre-potential phase increases. What do you mean by the slope? If initially on x-axis we have time, if initially it took from here to reach here, it took, let's suppose, 0.2 seconds. Now the potential reaches from minus 60 to minus 40 in this time. That is, let's suppose it is 0.1 seconds. So now the minus 60 becomes minus 40 in less time. That means slope of pre-potential increases. increases, as you can see in the graph. Then after the pre-potential, when it reaches -40, then there's depolarization, and then there is repolarization. Is that clear? So what is the effect of sympathetic nervous system? It increases the entry of sodium and calcium. When sodium and calcium entry increases, it increases the slope of pre-potential. Now we will see the effect of parasympathetic nervous system. What does parasympathetic nervous system do? It is opposite to that of the sympathetic nervous system. It decreases entry of sodium and calcium. When it decreases entry of sodium and calcium, what happens is that slope of the pre-potential decreases. Slope of the pre-potential decreases because they are now slowly entering. When they are slowly entering, so more time takes to reach from -60 to -40 value. Is that clear? Because they are entering slowly. So now from here it reaches here, so more time on x-axis we have time, so more time is taken. And when it reaches -40, then there is depolarization, and then there is repolarization. Is that clear? So what does parasympathetic nervous system do? It decreases the entry of sodium and calcium. And what happens because of that? Slope of pre-potential decreases. Now look at the action potential. What was the normal action potential? Normal action potential is shown in green. So the duration of the normal action potential is from here to here. Due to the effect of the sympathetic nervous system, action potential is now here. That means on x-axis we have time, so there is less duration of action potential due to the effect of sympathetic nervous system. So sympathetic nervous system increases the frequency of sodium and calcium, increases the slope of pre-potential, but decreases the duration of action potential. Now action potential takes less time because it is starting here but entering here. That means before. Clear? And what does parasympathetic nervous system do? Parasympathetic nervous system is here. Clear? So due to the decrease in the slope of pre-potential, now action potential starts here, it ends here. Here it ends from here to here. So here ends the action potential because of the effect of parasympathetic nervous system. That means the duration has increased. From here to here. So due to the parasympathetic nervous system, there is a decrease in the entry of sodium and calcium, which decreases the slope of pre-potential, but it increases the duration of action potential. Now we will see another point. Now let us suppose the normal duration of action potential is 0.4 seconds. Let's suppose the normal duration of action potential is 0.6 seconds. Clear? Now the sympathetic nervous system, it decreases the duration of action potential. Let us suppose it decreases from 0.6 to 0.4. That means in 1 minute more action potentials will be generated. So if more action potential will be generated, more impulses will be generated. So if more impulses will be generated, heartbeat will be more, heart rate will be more, because there is less duration of action potentials. Action potential is generated in less time. Similarly, this parasympathetic nervous system, it increases the duration of action potential. Let us suppose it increases from 0.6 to 0.8, which implies in 1 minute less number of action potential will be generated. Less number of action potential means less impulses will be generated, so heart rate will decrease. So what happens is that parasympathetic nervous system decreases heart rate because less impulses will be generated, and sympathetic nervous system increases heart rate because more impulses will be generated. Is that clear? So sympathetic nervous system increases heart rate and parasympathetic nervous system decreases heart rate. Simple concept. In the previous video we studied there is a phenomena called chronotropy. Chronotropy means generation of heart rate. Clear? And there are some factors which are positively chronotropic, which increase heart rate, and there are some factors which decrease heart rate, those are negatively chronotropic. So we can see here sympathetic nervous system increases heart rate, so sympathetic nervous system is positively chronotropic, and parasympathetic nervous system decreases heart rate, so parasympathetic nervous system is negatively chronotropic. Is that clear? So this was the effect of sympathetic and parasympathetic nervous system on the action potentials in the SA node. So what was this effect? I can show you this effect. If this was the normal action potential, clear? So sympathetic nervous system increases the duration of action, so sympathetic nervous system increases the slope of action potential, so this is the new action potential, and parasympathetic nervous system decreases the slope of action potential, this is the new action potential. Clear? So this was the normal duration, Due to the sympathetic nervous system, duration is decreased, and due to the parasympathetic nervous system, duration is increased. Because on x-axis we have time, we have duration. Is that clear? Now we have a very, very, very interesting information that I'm going to share with you. That is normal acinodal firing rate. Acinodal firing rate is 100 impulses per minute. AC node, what is the function of the AC node? It generates heart rate. Is that clear? But the normal firing rate of AC node is 100 impulses per minute. AC node fires 100 impulses, but our normal heartbeat is 72 beats per minute. Clear? But AC node fires 100 impulses per minute, but our heartbeat is 72 beats per minute. So what is happening? What is happening is because of the resting vagal tone. There's a phenomena called a resting vagal tone. What is this resting vagal tone? We know sympathetic nervous system increases heart rate, while as parasympathetic nervous system decreases heart rate. Is that clear? We know that from the previous slides. When a person is resting, there is the activation of the parasympathetic nervous system. That means when a person is resting, parasympathetic nervous system is active, and it decreases the heart rate from this 100 beats per minute to 72 beats per minute. Normally the heart rate should be 100 beats per minute, because AC node is firing 100 impulses, but in a normal individual, in a resting individual, heart rate is 72 beats per minute, because when the person is resting, normal person, parasympathetic nervous system is active, and this parasympathetic nervous system decreases heart rate even at rest. That is called a resting vagal tone, and it decreases heart rate from 100 impulses to 72 beats per minute. Is that clear? This was the first point. So if we give a person with atropine, what is atropine? Atropine is a drug that is parasympathetic nervous system blocker. So if it so atropine blocks parasympathetic nervous system. Now heart is acted only upon by sympathetic nervous system. So if we give parasympathetic nervous system, so this resting vagal tone will be absent, and there is only the activation of sympathetic nervous system. Then the person's heartbeat will be 150 beats per minute because of the action of atropine. What is this atropine? This is this parasympathetic nervous system blocker. Did you get my point? Because there is a blockage of the parasympathetic nervous system which decreases heart rate. There is no one to decrease heart rate. There is activation of there's only the presence of sympathetic nervous system which increases heart rate. So the heartbeat will be 150 beats per minute. Now another concept. Let us suppose we have a person, heart transplanted person, a person whose heart is transplanted. Clear? So this heart is de-innervated heart. That means it is that heart, it has no nerve supply. When it has no nerve supply, meaning it has no sympathetic nerve supply, it has no parasympathetic nerve supply, because it is transplanted heart, it is heart from a different donor, so it is a de-innervated heart. So if there is no sympathetic nerve supply, there is no parasympathetic nerve supply, then this person, his resting beats per minute, that means his resting heart rate will be 100 beats per minute. His normal heart rate will be his heart rate at rest will be 100 beats per minute. Why 100 beats per minute? Because his AC node is firing 100 impulses per minute, and there is no parasympathetic nervous system to decrease it to 72, and there is no sympathetic nervous system to increase it to 150. Is that clear? So the person having de-innervated heart, or the heart transplanted patient, there is not presence of sympathetic and parasympathetic nerve supply, his heart rate at rest will be 100 beats per minute. Thank you very much, your Dr. Ugbe. So this was the effect of, so this right here was the effect of sympathetic and parasympathetic nervous system on the acinodal action potential. This was the effect of sympathetic nervous system, and this was the effect of parasympathetic nervous system, and this is the normal action potentials of the SA node. Thank you very much, your Dr. Ugbe here. Keep revising, keep studying, and class dismissed.